Okay.
Okay, so hello and welcome to our first therapist interview on our new YouTube channel. The purpose of this channel is to highlight best practices and insights in the world of therapy for your benefit. Today we have Kyle Parrish joining us. He's one of our very own Pediatric Therapy Associate therapists within physical therapy, and we will be discussing some relevant topics within that practice. So hi, Kyle.
Hi.
And my first question for you is, how did you get your start within physical therapy, and what inspired you to choose the profession?
Okay. Well, I grew up in a medical family. My parents are nurses. My sister works as a radiology technician, and I saw what they did, and I liked it. I just thought it was great how they get to help people every day. It's exciting. You get to use your brain, your skills, things like that. I started exploring different medical fields, like nursing, things like that. And there were just other aspects that I just didn't like. I didn't like the over-reliance on medication. I didn't like the windowless rooms, the
Right.
beeping machines, tubes, stuff like that,
Yeah.
So my parents in their infinite wisdom said, you should check out physical therapy. And so they took me to a clinic, had me shadow for a while, and it's just completely different. It's, the therapists are spending like a good amount of time with their patients. They're helping them learn exercises, how to take care of their bodies. There's like big open windows with lots of sunshine coming into the clinic. It's like, this is it. Like, this is how we should be treating people, how we should be making people better. So that's how I got my start. And then, yeah, I ended up going to Loma Linda University, started out in an orthopedic job like most people do, decided it wasn't for me, and I started doing pediatrics.
Awesome. Well, I can see why you like it so much. It sounds very different than a lot of other professions.
Yeah.
And in that sense, so moving forward, how would you expect the practice of physical therapy to evolve over the next year, because it is so hands-on, like you were mentioning?
Yeah, it's been a challenge taking something like physical therapy and putting it over Zoom because of the pandemic.
Right.
It wasn't easy. I know personally, I was not for it when it started. It's like, how's this going to work?
Mm-hmm.
How are we supposed to feel muscles and conduct treatments, teach parents to conduct treatments? And it doesn't always work out. Sometimes it's super messy, but I've learned a lot, and I think we've all had to make a lot of changes to make it work.
Right.
So I think I think the future will be some telehealth in PT,
Mm-hmm.
but I think it's going to take a largely educational role going forward, which I think is a good thing, because I think
Mm-hmm.
that's the best part of PT, really.
Right.
Right? Despite how much hands-on we do, how much exercise, manual work, all that stuff, education is the most important part.
Mm-hmm.
It's like teaching your patients what's going on, how can I fix it, how can I be better.
Right.
So yeah, I think that's where we need to go moving forward.
Yeah, I think you have some really good insights there, and I can't even imagine, especially within your practice, how difficult the transition must have been, going from, in person, it's a very hands-on profession, into adapting to telehealth.
Right.
Yeah. And have you, just a follow-up question, have you been doing in-person sessions, or what has your new life looked like?
The new normal.
Yeah.
It's been okay. It's just I work for two different companies, both pediatric right now. With one, I do a mixture of in-person and virtual. And with the other one, as of now, we're just doing strictly virtual. And
Okay.
that's been going off and on throughout the whole year.
Okay.
Um,
I see.
so it's okay. I'm okay with still seeing a few patients in the home as long as it's just those few,
Mm-hmm.
in the home or the clinic in person.
Yeah.
Um, but it just gets scary in a time like this when you start hopping from multiple homes
Yeah.
and you're trying to clean everything, but you can only do so much.
Right. You never know. And then especially with the cases rising right now, I'm sure it's very, difficult to decide kind of what to do.
Right.
Yeah. But in closing, I have one more question for you. So do you have any closing remarks about physical therapy, how it's been impacted, or insights for other therapists that are trying to navigate the physical therapy world during this time?
Um, I just think that what this has taught me personally as a physical therapist who hasn't been out of school for that long is
Mhm.
that it's just hit me that education is the most important thing. Like from my experience, um, I've worked with adults, I've worked with children. There's a lot of things that could be solved if we could educate better.
Right.
And that doesn't just go for the physical therapy world because there's only so much that can be done there, but also for everyone. Like the more we do things on platforms like this, on YouTube or over the internet, the better. If we can just educate as many people as possible on, hey, this is how you prevent back pain. Hey, this is how you can get your baby to start rolling if they're having trouble with it. Just those little things, I think, will go so far. And then we, as physical therapists, can be there to provide the more complicated things, the things that our degrees require. But
Mhm.
simple things, I think we should really be pushing education to the masses, and just I think it'll be better for patients and for therapists moving forward.
Definitely. And yeah, I appreciate your positive insights too. Not everyone has that outlook right now, but I think especially like from my own perspective, what I've learned is like there's no limits to how you can share knowledge. Um, so I think that's huge. Um, but I'm going to close out right now. So thank you so much for joining me today and sharing your insights on physical therapy. I really appreciate learning from you and just hearing your story in general. And to everyone else, stay tuned for more relevant therapy interviews. We can't wait to continue providing premium interview content for you.